Today we are going to discuss about AMH. What is AMH and why is it regularly done in the fertility centers? Hello and hi everyone. This is Dr. Shravanti Reddy, fertility specialist, gynecologist at Shubha Fertility, LV Nagar. Today we are going to discuss about AMH. What is AMH and why is it regularly done in the fertility centers? People outside the people who are conceived or easy to conceive won't know about this test. It is only advised when the people are not conceiving. It is called anti-Mullerian hormone. Anti-Mullerian hormone is secreted by the follicles, that is granulosa cells present in the ovary. So basically what we see in the ultrasound, when the patient, we do a baseline scan or we do an antral follicle count, we check the number of follicles in the ultrasound. That is called as antral follicle count. It is generally done on the day 2 of the menstrual cycle. Exact number of the follicles is seen when you do it on the day 2. So that is called as antral follicle count. So basically what we see through ultrasound is antral follicle count. What we are not seeing, there are many follicles in the ovary. So basically all the follicles which are seen through ultrasound and not seen through ultrasound secrete this hormone called anti-Mullerian hormone, and this gives a better understanding of how much your egg reserve is. So it generally tells you about the egg number. It is generally done at what time? There is no particular time. It can be done throughout the month of your menstrual cycle. It is not particular on day 2 or day 5 like that. It can be done at any time of the month. Why is this test very important? So this test gives you the number of the follicles, the egg reserve patient was trying to conceive. This is the basic test we do when the patient walks into our clinic. What are the normal values of AMH? 2.5 to 4.5 is called as normal AMH, and 1.5 to around 2 is called as low normal or borderline. Less than 1 is very low AMH. So basically these values gives us an idea, and it helps us to explain the patient that if the values are less, we'll tell them to plan your pregnancy as fast as you can. If it is less than 1.5 or less than 1, we'll tell them to plan your pregnancy within coming 6 months, because the follicles are getting exhausted in your ovary. That is what the AMH test gives us the broad idea. And people ask us, does it give you the quality of the egg, AMH test? No, it doesn't. AMH test just tells you how much is your egg reserve. It doesn't always tell you the quality of the egg, but what happens is if they have very less AMH, like it is less than 0.5, less than 0.4, what happens is declining number of eggs, understanding that it might decrease the quality of the egg too. So it is always better if you have less AMH, low AMH. It is always better to speed up the pregnancy process. And people ask, why is the AMH low in patients? It is, we already know that increasing age will have the decline in fertility. That is due to decreased number of eggs and decrease the quality of the eggs. So this is one of the reason where you have AMH decline if you have increased age. And in patients with endometriosis also you have declined AMH. And also sometimes in young patients also we see decreased AMH. This it could be due to decreased reserve, since they might have since birth, or sometimes they have accelerated loss of follicles, accelerated loss of reserve. It also leads to premature ovarian insufficiency, and they have low AMH. This test finally tells you that the reserve is this much and you have to plan the pregnancy accordingly. So whenever you're planning pregnancy, first get this basic AMH test done, so that you'll have understanding that should you wait to conceive, or should you speed up the process of pregnancy. Thank you, and follow me for more content.